The rotator cuff and other muscle actions, presented by Megan Fry. In this lesson, we will go over muscle actions, rotator cuff muscles and actions, attachments and striations, and end with a muscle table. First up, we have muscle actions. Muscle actions are commonly used among humans in everyday life, but we don't usually have to think about how to move each muscle individually. Muscles only pull, they don't push, so visualizing each muscle contracting and getting smaller may aid in the process of predicting muscle actions. There are 14 muscle actions, 6 of which are scapula-specific, 2 are ankle-specific, and 6 are limb-specific. Scapula-specific actions include elevation, when the scapula is raised superiorly, depression, when the scapula is lowered inferiorly, retraction, when the scapula is pulled back towards the spine, protraction, when the scapula is pushed forward away from the spine, inferior rotation, when the scapula is rotated downwards, and superior rotation, when the scapula is rotated upwards. See the diagram to the left for a visual representation. The 2 ankle-specific actions include dorsiflexion, which is flexing your toes upwards, and plantar flexion, which is pointing your toes downward. The 6 limb-specific actions are flexion, which decreases the angle of the joint, extension, which increases the angle of the joint, abduction, which moves away from the midline, adduction, which moves towards the midline, lateral rotation, which rotates away from the midline, and medial rotation, which rotates towards the midline. Second, we have the rotator cuff muscles and actions. The rotator cuff is the 4 muscles surrounding the shoulder socket connecting the scapula to the proximal head of the humerus. The first muscle is the supraspinatus, which is a cylindrical muscle at the top of the posterior side of the rotator cuff group. Second, we have the infraspinatus, a larger triangular muscle at the middle of the posterior side of the rotator cuff group. Third, we have the teres minor, a smaller, flat, triangular muscle at the bottom of the posterior side of the rotator cuff group. And fourth, we have the subscapularis, a larger, flat, triangular muscle fitting the anterior side of the rotator cuff group. You can see the diagram on the right of the page for the locations of each of these. Third, we have the attachments and striations. For the supraspinatus muscle, the medial attachment is at the supraspinatus fossa of the scapula, and it connects to the lateral attachment point at the greater tubercle of the humerus. The infraspinatus muscle connects medially at the infraspinatus fossa to the greater tubercle of the humerus. The teres minor connects medially at the lateral border of the scapula and laterally at the greater tubercle of the humerus. The subscapularis connects medially at the subscapular fossa and then connects again at the lesser tubercle of the humerus laterally. The supraspinatus muscles and the teres minor muscles have diagonal striations, while the infraspinatus and the subscapularis muscles both have horizontal striations. Finally, we have our muscle table. As you can see, each column has the muscle, the medial attachment point, the lateral attachment point, and the muscle action. The supraspinatus muscle connects medially at the supraspinatus fossa of the scapula, laterally at the greater tubercle of the humerus, and its action is abduction of the shoulder. The infraspinatus muscle connects medially at the infraspinous fossa of the scapula, laterally at the greater tubercle of the humerus, and its action is the lateral rotation of the shoulder. The teres minor connects medially at the lateral border of the scapula, laterally at the greater tubercle of the humerus, and its action is lateral rotation of the shoulder. And the subscapularis connects medially at the subscapular fossa, laterally at the lesser tubercle of the humerus, and its action is the medial rotation of the shoulder. Thank you for listening to my presentation. I hope you learned a lot.